Hello, this is Dr. Praveen Ramachandra. I'm senior endocrinologist working in Diaplus Endocrinology Clinic, Yelahanka, Bangalore, India. Please watch this video.
Okay, welcome in everyone. If you or someone you love is navigating life right now after a coronary artery bypass graft, a CABG, well, it can honestly feel pretty overwhelming at first. So today, we've got a highly specialized explainer designed specifically to help you out with that. This guided patient education journey is brought straight to us by Dr. Praveen Ramachandra, senior endocrinologist at the Diaplus Endocrinology Clinic over in Yelahanka, Bangalore, India. We're going to break down exactly how you can safely and really effectively reclaim your health, especially if you're managing diabetes at the same time.
So let's just dive right into this. When you hear the phrase cardiac rehabilitation, it's super easy to just picture someone sweating it out on a treadmill, right? But actually, scratch that. That's a huge misconception. Rehab is way more than just hitting the gym. It's really this comprehensive medical safety net for your recovering heart. It's a fully supervised program that mixes structured exercise, vital education, and crucial risk factor control. It isn't just about getting fit, it's literally about strategically lowering your chances of ever having another heart problem down the road.
And here's our quick roadmap for today's explainer. 1. Your cardiac rehab roadmap. 2. Healing after heart surgery. 3. Why diabetes changes rehab. 4. Smart exercise for diabetics. And finally, number 5, your lifelong heart plan.
Okay, starting off with Section 1, your cardiac rehab roadmap, the journey to recovery. Think of your rehab journey kind of like a three-part marathon. Phase 1, well, that starts while you're literally still in your hospital bed. It's all about early mobilization. Simply sitting up, doing some breathing exercises just to keep those lungs clear. Then Phase 2 kicks in right after you head home, lasting roughly 1 to 12 weeks. This is your supervised outpatient period. You'll start graded aerobic exercises, really learn the ins and outs of your medications, and begin making those key lifestyle shifts. And then finally, Phase 3, which is everything after that 12-week mark. This is where the training wheels come off. It's your long-term maintenance phase at home where you permanently bake these new habits into your everyday life. Moving on to Section 2, healing after heart surgery, and specifically, protecting your chest.
6 to 8 weeks. I really want you to burn this number into your brain. This is exactly how long it takes for your sternum, your breastbone, which had to be opened during the surgery, to heal up properly. This time frame is, without a doubt, the ultimate anchor for pretty much all the physical restrictions your surgical team is going to give you.
So what does that 6 to 8 week healing window actually mean for your day-to-day life? Basically, it means strictly following what doctors call sternal precautions. Translating that into everyday language, absolutely no heavy lifting, and definitely avoid activities that aggressively strain your chest or your upper arms. Look, your body is doing some seriously heavy lifting on the inside just to heal that bone and tissue. So during these early weeks, simple walking and just gentle, purposeful movements, those are absolutely your best tools to build up endurance safely. All right, Section 3, why diabetes changes rehab, or what we like to call the diabetic twist.
Now, what's really interesting about this slide is seeing the contrast. Standard rehab is challenging enough on its own, right? Focusing on graded exercise and diet. But diabetic rehab? That requires an entirely extra layer of vigilance. Why? Well, because hyperglycemia, high blood sugar, can actually increase your risk of infection and slow down that absolutely crucial sternal healing we were just talking about. So, if you're managing diabetes, we've got to add in strict glucose monitoring, super vigilant wound care, and honestly, a much slower, more deliberate progression when it comes to exercise. I absolutely love this quote straight from Dr. Ramachandra's guidelines. It says, "Diabetics do not need less rehab, they need smarter, more structured rehab." You should really feel empowered by this. Having diabetes doesn't mean you're fragile. No way. It just means you need a smarter, highly customized strategy. You are still totally in the driver's seat of your recovery. You just happen to have a slightly more advanced dashboard to keep an eye on.
Let's jump into Section 4, Smart Exercise for Diabetics, focusing on safe daily habits.
Think of this right here as your pre-flight mental checklist. Step 1, always check your glucose before a rehab session. Step 2, if it's low, pump the brakes, delay the exercise and treat it first. Step 3, if you're nicely in that target range, you're good to proceed safely. And Step 4, recheck your glucose after exercise. Now, why does that last step matter so much? Well, exercise burns sugar, and your glucose levels can actually take a nosedive hours after your session is totally over. Catching that delayed drop is absolutely vital. Let's put some specific numbers to this.
Generally speaking, your safe target zone for exercise is right between 5.6 and 15 millimoles per liter. Under 5.6, that's too low, treat it first. Over 15, that's high, and you've got to exercise with extreme caution and clinical review. Oh, and a very special note here. If you happen to be on insulin or sulfonylureas, those are specific glucose-lowering pills, you need the closest monitoring possible. Combining those meds with exercise can sometimes trigger a sudden hypoglycemic event, and we definitely want to avoid that.
So, the crucial point is that your daily safety habits dictate your long-term success. Always carry a fast-acting carbohydrate during your sessions just in case. Never skip meals before rehab if you're taking glucose-lowering drugs. When you do exercise, start easy. Low-impact walking or maybe some stationary cycling. Be kind to your joints and that healing chest. And remember that 6 to 8 week sternal healing window. Do not add light resistance training until after that has passed completely. Finally, if you have neuropathy, make it a daily habit to inspect your feet for any hidden sores or blisters. Start slow and go steady.
Which brings us to our final section, Section 5, your lifelong heart plan, staying vigilant. A huge part of that lifelong vigilance is knowing exactly when to raise your hand and just say, hey, I need some help. These right here are your urgent warning signs. If you get chest pain that just won't go away with rest, worsening shortness of breath, fainting or sudden dizziness, stop moving. Also, keep an absolute eagle eye on your surgical wounds. If you notice any redness, discharge, if you run a fever, or see swelling in your leg where the vein was harvested, do not wait around. Call your medical team immediately. Being proactive like this is exactly how you protect that newly repaired heart of yours. At the end of the day, surgery fixed your heart, but your daily habits are what will actually protect it. Whether it's taking that very first gentle walk down the hallway or just remembering to check your blood sugar before you exercise, every single small, smart choice you make is a massive victory. Armed with this incredible guidance from Dr. Praveen Ramachandra, you are now fully prepared to take control of your recovery journey. So the only question left is, are you ready to take that first step? Thanks so much for learning with me today, and hey, here's to your strong, healthy heart.